Neurological damage and neuroprotection. Now, the reason I want to talk about this next, and actually a lot of today is setting the stage for moving into talking about specific disorders in their treatment. But something that I think is interesting, also very hopeful and exciting in psychopharmacology, is the finding that some of these drugs are neuroprotective, that stress can damage the brain, and sometimes very substantially, and certain psychiatric medications can either protect the brain from damage or can result in repair of the nervous system. Okay? I think many lay people assume that the drugs are like tranquilizers and alcohol, that you take the drug and you feel better, but when the drug's gone, you're back to square one. And that is true about tranquilizers, okay? And it's true about stimulants, probably. It's true about alcohol. But some of these drugs actually have more profound effects that protect the brain. The culprits, here they are. High levels of cortisol seen in depression. This is in unipolar or bipolar depression. Okay. Toxic levels of cortisol can cause brain damage. Also in very severe stress. Now I want to be very clear about this. The type of stress that we're talking about here is not ordinary stress. It's the kind of stress that you get when it's extreme potential danger, it's chronic, and there is the perception that the person can't escape. And this might be what you see in a war zone, where every day the parents are afraid their kids might get killed by a bomb or something. Okay? You see it certainly in severe ongoing child abuse, and you see it in domestic violence. Now, the perceived lack of control, again, many lay people erroneously think, well, if this woman's getting abused, she could just leave. And I should say that it's not only women that get abused. Sometimes men get abused, domestic violence. Mostly it's women. But as therapists, as we know, that is not that easy a thing to do, is just leave. Okay, so it's a perception of having no escape, no choices, no ability to cope. That can result in sustained levels of cortisol. You can have people have a horrible thing happen, like getting raped, and yet they won't have chronic high cortisol levels. It may, bounce up to high levels for just a while, but quickly re-regulates itself. The ongoing psychological trauma of that can be devastating for a lifetime, but in terms of damaging the brain, it's not likely to. Glutamate, this is released in abnormal amounts, really in three main situations. One is mania, okay? And I'm talking here about toxic levels of glutamate, this excitatory neurotransmitter. And when it's in toxic amounts, it's referred to as Excito Toxicity. So it's activating the excitatory effects of glutamate to a level that causes damage to the brain. You see this in seizures, especially grand mal seizures, where there is a massive release of glutamate. And if you don't control epilepsy, get a lid on it quickly, it can progressively get more severe, because with each seizure it's causing additional brain damage. And you see it post-stroke. And you know how they have heart attacks? They call it heart attacks instead of a myocardial infarction. They're trying to get the name stroke changed to brain attack, to get across the message that this is an acute emergency. And even with small strokes, people need to go to the emergency room, and a part of what they do is administer drugs that block glutamate, because a significant amount of the damage from a stroke, of course, is the loss of blood supply to a part of the brain that kills hundreds of millions of nerve cells. But secondary to that is the brain responds by releasing toxic amounts of glutamate, and some of that kind of damage can be reduced if you get very quick medical attention following a stroke. Okay. Increased in intracellular calcium in bipolar. We'll get to the details of that later, but this is where calcium channel blockers can be effective. You get too much calcium into nerve cells, especially in the frontal lobes, and it'll kill them. I'm not going to go into the details of this, but there's a particular enzyme that builds up in nerve cells in bipolar, and for reasons that are complicated we'll get to later, can cause brain damage. And then finally is oxidative stress. And everybody is constantly, our bodies are getting worn out because of oxidative stress. This is just metabolism in general causing the development of oxygen-free radicals that damage tissue throughout the entire body. It's probably the main cause of aging to every organ system, in the skin and skeletal system included. And what's been discovered recently is, well, first off, let me say this, that the degree of oxidative stress, the production of free radicals, is closely tied to the rates of metabolism, and the highest rates of metabolism in the body are in the brain. So already in normal folks you have an excessive amount of free radical activity in the brain, but what's been discovered recently is during both major depressions and mania there's a significant increase in oxidative stress in the brain. And so this is yet another form of brain damage that can be associated with mood episodes. Okay. In addition to each of those potentially toxic molecules, we also have the decreased availability of protective proteins. And the brain is loaded with a host of proteins that either protect the brain from this kind of damage or activate mechanisms of repair of the nervous system. Let's see. Actually, you know what? I think I'm going to skip over this material right here, just in the interest of time, and talk about protection and repair of the nervous system, because when we talk about each disorder, we'll come back and talk about specifically how those particular molecules damage the brain, but protection and repair of the nervous system. All right. This is a big guy in the block. This is brain-derived neurotrophic factor, BDNF. And in the last 5 years, there's been almost 6,000 studies on this done worldwide. So it's a hot item to research, and it does a number of things. One is it helps to repair nerve cells when they've been damaged. Nerve cells can be damaged by trauma, head injuries, for instance, by diseases such as degenerative diseases like Parkinson's or Alzheimer's disease, by exposure to toxic levels of cortisol, glutamate like we talked about before, and also just normal aging. And so BDNF plays a role in ongoing, kind of cell maintenance, maintaining the viability of nerve cells. A relatively recent finding is that it can reduce the toxic effects of high levels of cortisol. When the brain is getting hit by extraordinarily high levels of cortisol that potentially can cause brain damage, this protein will get activated to bind onto cortisol and cut it in half. And therefore it renders the effects, potentially can negate the effects of high cortisol. Okay? In the hippocampus, the brain has a capacity for growing new nerve cells, and BDNF activates this neurogenesis and also cell growth. Now the problem, let me just show you this one slide here. This is a nerve cell in the laboratory, they shoot some BDNF in here, and a day later, look at the massive growth of dendrites. It's just huge. So this is a protein that's really being looked at in terms of trying to treat disorders where there's a progressive deterioration in the nervous system, like Alzheimer's disease, for instance. And the results of that are not conclusive yet, but there's a lot of promise here. Okay, now, some of the amount of BDNF the brain makes is due to genetics. And some people come into the world and they have huge stresses. By anybody's account, they should be a mess psychologically, but they emerge from that and they're okay. Now that's a small percentage, but these are highly stress-resistant, resilient kids. A part of that can be explained by psychology and by their social network and so forth, but also some people are just born into the world with multiple genes for making this protein. And so their brain is protected against the damaging effects of high stress or depression. But the big problem is that BDNF is reduced big time in major depression and prolonged states of helplessness. And so the damage is done with mood disorders in terms of high cortisol levels accompanied by the absence of this protective protein. Last year it was discovered that you can measure BDNF levels in the bloodstream and they reflect the levels in the brain. And that's very good news, because I think that within a year this is going to become standard protocol when people get worked up for treatment of depression. Also, when they respond to the antidepressant, or the studies aren't there yet, but probably psychotherapy, but with antidepressants, when they respond, BDNF levels normalize in the brain and in the bloodstream. So you'll have a biological marker of depression, but also a biological marker of improvement. Okay? Now, here's the pharmacology part. All of the antidepressants increase BDNF levels. And in fact, this may be the main effect of antidepressants, is to reactivate the production of BDNF, which will protect the brain, but also heal at least some degree of the damage that's been caused by stress. This is true for all classes of antidepressants, those that target serotonin, norepinephrine, and dopamine. The two exceptions are the over-the-counter remedies, SAMe and St. John's wort. They may increase BDNF, but there just aren't any studies of that.